Jeff. To keep things brief, I will simply give you an overview of the data and the state of where we are as a country. Yesterday, CDC reported 103,445 new cases of COVID-19. Our 7-day average is about 89,463 cases per day. This represents an increase of 43% from the prior 7-day average. The 7-day average of hospital admissions is about 7,348 per day, an increase of about 41% from the prior 7-day period. And 7-day average daily deaths have also increased to 381 per day, an increase of more than 39% from the previous 7-day period. We saw 614 new deaths reported to CDC on Tuesday. 83% of our counties in the United States are experiencing moderate or high transmission, with Delta variant continuing to be the predominant circulating virus. Across the board, we are seeing increases in cases and hospitalizations in all age groups. Those at highest risk remain people who have not yet been vaccinated. Now is the time to get vaccinated. We know these vaccines are working, and we know they save lives. Thank you. I'll now turn things over to Dr. Fauci.
Thank you very much, Dr. Walensky. I'd just like to spend a minute or two addressing a concern that I continue to hear regarding the speed with which the vaccines were developed. And this is usually among people who have a degree of vaccine hesitancy or reluctance to get vaccinated. It really relates to two things that have gone on that people need to appreciate. One is the logistics and the investment in resources that was made, and others is the decades of basic and clinical research that antedated the development of the vaccine. What about the logistics and the resources? Generally, when you develop a vaccine, the thing that usually takes years to do, you do it in a sequential fashion. In other words, in order not to waste money, as it were, you do something preclinical, phase 1, phase 2, phase 3, and then you start manufacturing the product. You do that sequentially because if the first one doesn't succeed, you don't want to go to the second, third, and fourth step. Because of the wise investment in Operation Warp Speed, and we give credit to the Trump administration for doing this, particularly Secretary Alex Azar, who was an important component of that. What you did was make an investment to prepare for phase 2 and phase 3, even before you knew the phase 1 worked or not, and to start manufacturing. So when you do that, you make a major investment in resources. If the vaccine doesn't work, you've lost a lot of money. If the vaccine does work, you saved a lot of time. And that's exactly what happened. In addition, we had the clinical trial sites that we had built decades earlier for HIV and influenza, which were used to do the clinical trials. And third, unfortunately for us, but fortunately for the vaccine trials, we were in the middle of the summer surge when the phase 3 trials were initiated. So next comes the decades of basic and clinical research, both in platform technology and immunogen. It didn't start in January of 2020 when the sequence was put on a public database. The data, the experiments on mRNA approach, which was funded predominantly by the NIH and also industry was involved, started decades earlier to develop an mRNA molecule that could be used as an immunogen for a vaccine. In addition, the vector-based approach, such as the one that J&J did, was again done 10 or 20 years earlier with HIV. And the now very, very elegant work of the development of an immunogen that would be highly immunogenic to get the kind of high efficacy and effectiveness that we got was work done at the NIH Vaccine Research Center and by many of our grantees over the previous literally 1 to 2 decades. So when people say, I'm concerned that this went too fast, it did not go too fast. It was a major investment, both in the logistics, the resources, and the clinical and basic research. So I'll hand it now back to you, Jeff.